What if you woke up one day and saw this in the mirror? That was the frightening reflection for our next guest.
In 2009, I was sitting at dinner and all of a sudden I felt like I had this burning sensation go throughout my body, and it felt like almost red ants, like someone threw acid on my body. I get to the emergency room and they really hadn't seen anything like it before. I got tested for leukemia, vasculitis, lupus. I had probably 75 different blood tests taken. Each one was for a different blood disorder, a skin disorder, a vessel disorder, heart disorder. All those tests came back negative and they couldn't find anything. My mom had flown into town because she was worried about what was wrong with me.
When she opened her apartment door, what I saw was horrific. She was bleeding from the corners of her eyes, and it was my little girl. And I just wanted to shake somebody and say, can't anyone help this child?
A few months went on, and when I was in the doctor's office, you know, he could tell that things were getting worse for me. So he gave me some naproxen.
You feel hopeless as a parent because no one's helping and you can't do enough. And I felt guilt about that for a very long time.
In the meantime, I had another reaction. My mom and I went to my aunt's to have dinner, and my muscles started feeling really sore. My aunt handed me a naproxen. I took the pill, and about 30 minutes later, my body started going into shock. And soon after that, my mom came in the bathroom, and I said, "Mom, I think it's the naproxen." Once we had figured it out, I again was left with all these marks. I knew, yes, I should not take this medication anymore, but what am I going to do about my body? Even after 6 years, I still have this discoloration.
And Lauren joins us now with her mom, Nancy, who just even watching that piece, you know, your mom I see is tearing up even more than you because she knows how troublesome it was. You didn't know what was going on.
Exactly, yeah. I had no idea.
So basically, in the end, they're saying that the naproxen, your whole body was having an allergic response to the naproxen and causing this outbreak.
And that's what's crazy is people don't realize how many of these over-the-counter medicines actually will have reactions, not very common to see quite like you had, but commonly cause these skin reactions. And joining us now is dermatologist Dr. Sonia Batra, who is going to explain, those were really rough looking, essentially bruises. Again, I can't imagine waking up and seeing those, but again, not uncommon to see skin reactions to some of these over-the-counters.
No, in fact, about 2 to 3% of people taking over-the-counter medications can experience some sort of skin rash. But the kind that Lauren had is less common. It's actually called a fixed drug reaction. Generally, with a fixed drug reaction, it starts with just one or a few plaques. And the reason it's called fixed is it always comes back in the same place. And sometimes it's very hard to diagnose because it's something you don't take all the time.
So best treatment obviously is avoidance, but in cases where you have residual skin issues, lasers can be beneficial?
Yeah, so the other aspect of fixed drug reactions is because the inflammation is right at the level of skin where you have pigment, it always leaves hyperpigmentation. And while that's more common in someone who's darker or olive toned, we see it in someone even very fair, and I think that's what made it very scary. But the key is because the pigment is a little deeper in the skin, sometimes it takes multiple treatments. It's a little harder to fix than most pigment disorders.
Well, Lauren, we actually have a little surprise for you. So Syneron Candela Laser is actually going to set you up with 3 V-Beam Perfecta laser treatments in your hometown of Kansas City to help with the hyperpigmentation, so that we hope you can get some rest.
That definitely will help.
Appreciate it.
Thank you both so much for being here. Thank you, Dr. Batra.